Hey everyone, today I want to talk about the difference between open and closed rhinoplasty. I hope to address some myths in this video and dispel some of the misinformation out there, and hopefully add to the discussion about these important topics. So, in my opinion, there's really two major differences between open and closed rhinoplasty. The first one is there's a little scar right across the columella in open approach to rhinoplasty. This is something that is sort of a hard and fast difference. It cannot be changed. It's always going to be there during an open rhinoplasty. Luckily, it's well camouflaged, it heals quite well, and it's very, very small. The second main difference is most important, okay? And this is what I think you should consider most highly when you're thinking about doing surgery. And that's, what does the surgeon prefer to do? What is their experience with that approach? So essentially, some surgeons specialize in closed approaches and they prefer it to get the results that they are comfortable with, and I think they get excellent results. The other camp is the same thing with open approaches. These surgeons prefer the open approach and they use it to get their results. In either case, the results can be excellent, so it really just matters what's the surgeon's plan and how it applies to your case. So it's really important to do the consultation, ask them which approach they prefer and why, and view some before and afters that are similar to your case, etc. There is some discussion about the recovery. Yes, in the closed approach you don't have to go through the scar recovery, so in that way it's kind of easier or faster, but really the swelling and all that is actually fairly similar because you still have to do the surgery and you still have to change the cartilage and the bone, and so actually that can be quite similar between the two approaches. If I had to guess, I'd think that maybe 70% of surgeons prefer the open approach, and the usual idea is that using the open approach, you can see everything the way it just sits naturally, and it's easier to get a good result because of that. However, as I mentioned before, there are excellent closed rhinoplasty surgeons out there, so again, it comes down to your individual case and your very specific consultation with your surgeon. Anyway, I hope this sheds some light on the issues regarding closed and open approaches to rhinoplasty. If you're interested in setting up a consultation, we'd love to meet with you. So give us a call, send us an email. We'd love to have you in.